Hi, this is Dr. Pietro Aparicio from 72 Dragons Health. Today I want to talk to you about the New England Journal of Medicine. This is one of the world's leading medical publications, which is very important for most doctors, and most doctors will recognize it. But many other people might not. This is like the New York Times to the New Yorkers. So they did actually very interesting. In 2010, they released a documentary called Getting Better. And this documentary, they explore the evolution of medicine. It is a three-part documentary. The first part is called The Rise of Surgery, where they discussed or present the first public surgery using ether anesthesia. That was in 1846, all the way to the sophisticated operating rooms, of our times. Part two is the story of leukemia. This is the first treatment of leukemia in 1948. To now, we have many more options for patients with leukemia. They're not always successful, but they're better than they were in 1948. And the third part is the plague of our times. This is a story about HIV/AIDS. And they talked about the first cases of HIV/AIDS. The first case was actually in the United States in 1968. And on this documentary, Dr. Tony Fauci appears. And if you have been watching the news, Dr. Fauci is part of the White House Coronavirus Task Force, and its advisor to President Trump. And I'm talking about this documentary because this is another great example of the collaboration of medical doctors, medical professionals, health professionals with filmmakers. I don't think this great documentary, portraying the story of medicine or the history of medicine could have been possible without the filmmakers. And filmmakers out there know that this, even though it's a documentary for 45 minutes, it didn't take 45 minutes to do it. It didn't take 3 hours to do it. It probably took months to years to complete it. All the pre-production work, the production work, the post-production work, it all is a lot of labor of love. And it really takes a lot of creativity and effort to bring to life what doctors want to portray with the history of medicine is. So it's a wonderful way to collaborate for both fields, the field of medicine and the field of filmmaking. Thank you again, and stay home, stay safe. Bye-bye.